Welcome to Module 3, an Introduction to Health Program Planning. This is a crash course. I don't expect you all to be experts by the end of it, but it's supposed to begin to introduce you to the principles that will be reiterated throughout this course. This week, we'll learn the steps of health program planning. These are the objectives also listed in your module page on Canvas. This is an introduction and is meant to help you to think through the steps that would be required to develop and implement a health program plan. As we consider a priority population, we want to utilize data and resources, then develop an overarching goal and those action steps, or SMART objectives. So before you develop a health program plan, it's really important to assess population health, and that may be infectious diseases like COVID or flu, maybe a chronic disease, maybe an environmental disease like cancer or heat stroke. It may also be associated with whether somebody has access to care. So if they're due for an annual mammogram, but they don't receive a notice from their health insurance company, then that might be, there might be a health intervention that can be done there. And then on this slide, it shows a cigarette box actually in India where it says tobacco causes painful death. We do know that smoking, for example, causes a whole slew of diseases from cancer to emphysema and more. So thinking about health interventions is really important and kind of what the needs are, and trying to find the data around that is really, really key as a part of a community health needs assessment. So health program planning is the process of designing, implementing, evaluating an intervention to help improve the lives of individuals or community members in a population. So you really need to assess the needs, set goals, create strategies, and monitor and evaluate so it can last for a long time. So as I mentioned, data is really important to collect. And you'll create a needs assessment based on this data, and this could be, these can be longer reports, these can be smaller reports. It depends on the brevity of your health program plan, but it's really important to ensure that data is included. Then you'll actually think about the intervention and the priority population and develop some goals, objectives, and activities that work for that population. And what's great about doing this with a community is actually getting their involvement. I highly encourage that as available. SMART objectives are really key here, making them specific, measurable, attainable, or achievable. Realistic and time-bound is really key to actually, when it comes to the implementation phase, it makes it a lot easier when there's all those specific right there. This might also include like staff resources, where it's going to take place, which community, which zip codes, whatever. And then actually evaluating your goals, activities, and objectives is really important. I'll talk more about that later. I also just wanted to mention that proceed model is an 8-step process to implementing a health program plan. And there's many other models too, but this is just one model we're going to be talking about later today. It's really the predisposing, reinforcing, and enabling constructives, and the policy, regulatory, and organizational constructs in educational and environmental development. That's kind of the gist of what proceed is. I also just want to take some time for us to think critically through some health programs that you've seen in your community, and also think about with your groups some really great, data. Where was some data that you've seen? What websites do you know about? Healthy people. What goals would we have for a community? Just start thinking about that, and we'll chat in groups, and then we'll have a little bit more discussion on health program planning to wrap up. So thanks for meeting in your groups. I heard some really great discussions going around about how you would collect data or how you would utilize existing data like Healthy People or BRFSS, Behavioral Risk Surveillance Survey, Risk Factor Surveillance Survey, or the California Health Interview Survey. I heard some really great ideas about partnerships and collaboration to develop interventions and create those SMART objectives, goals, and activities, which is awesome. I also really heard some great ideas as far as how it would be implemented and maybe creating a budget or actually applying for grant funding to support the intervention. So those are all really fantastic. I also heard some really awesome ideas around the evaluation piece, having both a process and outcome evaluation, having an impact evaluation, so all really awesome things. And we're going to talk more about the pre-seed proceed model, but this is a really great breadth about the introduction about what health program planning is, and I really hope you enjoyed today's lesson, and I look forward to seeing you all in the next one.